Why does Explant cost nearly as much or more than getting the implants in the first place? And shouldn't taking them out be simpler and cheaper? That's logical thinking, right? But here's the thing, when you're talking about explant surgery, you're investing in not just the removal, it's a lot of times fixing what time and implants have changed in the first place. So today we have Dr. Luke Swistun, whose patients give him a rating of 4.9 out of 5. I don't know where that extra point one is. I personally would give him 5, but we'll give him 4.9 out of 5, and is our breast implant removal specialist. And he's here to explain why explant surgery is far more intricate than people realize. So welcome back, Dr. Swistun.
Thank you very much, Monique. Thanks for having me.
So women hear that, that explant surgery is more expensive than getting the implants. Is that really true?
Well, it's a complicated question. The answer is yes and no. And I'll start with the no first. So, just to get the implant out and do nothing else is actually very inexpensive. That can be done under local. The patient does not even have to go under general anesthesia for that. We can just numb up the area, the little skin incision through which the implant was placed, and we can go through that area and remove the implant and then close that and call it a day. And that is, again, a very quick procedure. The problem is, though, that that's all it does is it just removes the implant, but it doesn't really deal with the sequelae of having the implant for a while. So first of all, as everyone knows, the implant or any foreign object that is put inside of a human body creates scar tissue around itself, which we call a capsule. This is true for pacemakers, artificial joints, shrapnel, breast implants, whatever. The body just basically walls off that object just as a way of protecting itself to some extent. And that capsule just now becomes a part of the body. It's a scar tissue that the patient wasn't born with, but it's there as a consequence of having a foreign object inside. And there are certain arguments whether or not that capsule should be removed as well. And that's a whole other conversation that we can have on a different podcast. But suffice to say, a lot of patients would like that capsule removed as well. And that is what makes it a lot more complicated now, because that capsule is adherent to everything that that implant has ever been in contact with initially, right? So if you think about a breast implant, those have a pretty large footprint on the patient's chest. They're right on top of the ribs, like 4 or 5 ribs. They're underneath the pectoralis major muscle, underneath the bottom of the breast, and on top of the pectoralis minor, which is off to the side there. And all of those are now covered in this capsule. So if a patient really insists on just being back, brought back to factory settings, which is a term I hear a lot, and wants everything out, including the implant and the capsule, now we have to be very careful negotiating the capsule off of all those structures without causing a lot of collateral damage. And that's the part that takes a lot more time. That's the part that actually usually requires a longer incision. And that's also a part that we cannot do under local. So right away, if you just want to deal with the sequelae of having an implant and nothing else, getting the implant out and the capsule out, that already puts us in a category where it's a lot more complicated than just putting an implant in. The bigger issue that comes up afterwards is now after we remove the implant and the capsule, then the patient is back to square one. They're basically back to the shape of the breast that they started off with that prompted them to get the implant in the first place. For whatever reason, they're not really happy with it. And that's the best case scenario. Sometimes that implant can actually have caused a little bit more changes, unfavorable changes to the breast itself. For instance, if somebody had very large implants, then the skin has grown around those implants. And now if that implant is removed, then the patient has more redundant skin, more loose skin, and that's going to make the breast saggier. So now we have to figure out a way to make the breasts look better or more favorable or whatever the patient prefers without an implant. So that is an extra level of challenge on top of what we already were dealing with in the first place. Once that implant is not an option anymore, every other choice after that becomes a lot more complicated. We're talking about breast lifts, which takes the breast apart and puts it back together in a different configuration. We're talking about auto augmentations, which is taking the patient's tissue from the bottom of the breast and repositioning higher. We're talking about fat grafting and all these other procedures that are a lot more involved, a lot more time consuming, obviously. And as we know, time in the operating room is money.